Thank you all for joining us today for our webinar, Cybersecurity Trends and Issues in Healthcare. So key controls to enable greater resiliency in managing risk and compliance. My name is Kenan Rooney and I'm going to be facilitating today, and I just want to go over some high-level information about this webinar. It's being recorded, as you can see. So you can submit your questions in the comments or chat, and if you do have a question, you can raise your hand or comment and I can unmute you. We are offering 1 CPE credit right for this session. So there are polling questions. You need at least to answer 3 of these polling questions and stay for the duration of the webcast, and we'll mail you your CPE certificate in a few weeks. There will be a survey forwarded to you afterwards. And just a heads up for you, we are going to have another webinar on August 3rd around payer and provider and the talent marketplace and challenges in that. So you'll see more information, but that's just our plug to let you know we're going to be having another webinar on a different topic. So with that said, I'd like to introduce you to Lynn Rowland, who can introduce herself and will be leading this discussion. Lynn?
Sure. Thank you, Kenan, and to everyone who's joined us today for the webinar. My name is Lynn Rowland, and I lead our cybersecurity and data privacy practice, and I've been with the firm for 6.5 years, and I'm really excited to be able to give this presentation today. Our agenda is going to start with a cybersecurity healthcare trends overview, things that we're seeing in the marketplace, especially throughout the first half of 2023. It's going to be followed by a review of what the threat landscape looks like just in general, but then we're going to take it down a level and we're going to look at how the landscape and cybersecurity activities that are occurring are impacting payers and providers and third-party administrators. I'll share some findings from the past 2 to 12 months, what we're seeing as a result of the cybersecurity audits and program assessments that we've been performing in support of healthcare entities. We always find that pretty fascinating. And we're not going to just say what is going on in the landscape and what we're seeing, but we want to offer some leading practices for how to remediate some of these cybersecurity program gaps and remediate the risks that are associated with the types of findings that we'll walk through. They'll be high level, but they should be still useful. And finally, we'll review briefly what healthcare organizations are doing to enhance their cybersecurity programs through budgeting efforts. So we'll go ahead and start with some of these trends that we're seeing around, firstly, major digital transformation initiatives, such as extending services beyond clinical walls and enabling things like telemedicine. We're seeing an uptick in cyber defense investments, which again, I'll get into later, as I mentioned at the beginning. And this is a result of various cyber attacks and data breaches that are affecting hospitals and providers, mostly. A potential interest is that May 2023 was the second worst ever month for healthcare data breaches. It was second only to September 2020, which was the worst by, I think, an additional 95 breaches that occur. But month over month, what we're seeing is that there's been a 44% increase in data breaches that have been reported just for 2023. So it's can be very crippling and very costly. We'll get into that a little bit more going forward. Patient data continues to be the most valuable type of data, making it the ideal target for criminals. But most of you already know this. So what can I tell you that would be interesting? Well, the average healthcare record can now fetch almost like $1,000 in money. So whereas on the dark web, what we see as a credit card number is only worth $5, and Social Security numbers are worth $1. But that should really underscore why criminals are attacking healthcare entities, because of the value of that type of data. Finally, there's a profound shortage of skilled cybersecurity experts and IT professionals. And so when this is since this is the case, it's making it really difficult to retain employees and the right skill sets and talent within an organization's IT department or cybersecurity program. So I think we can move on to.
Yeah, Lynn, I just have a quick question for you. You
Sure.
said that May 2020, I mean, sorry, 2020 was the worst cybersecurity. Was that right? Because people were like jumping on the COVID wagon of like, okay, this is the time to attack. Is that why that was such a weird, it's just.
Yeah, so September 2020, you're correct, was the worst month for healthcare data breaches.
Okay.
And it was most definitely as a result of targeting employees who were working remote at that time. Maybe some started to go back to work, but that's typically, who the targets were, employees that were working remote.
Got it. Right.
Yeah, thanks for asking. So we'll move now to the threat landscape, and we're going to dig a little bit more into the specific cyber threats and the risks to the healthcare sector. Again, maybe some of these you'll already know, but it's really good just to create this level set. Ransomware attacks continue to rise. No end in sight or decrease expected with that, and the tactics are clearly targeting payers, providers, and third parties of the healthcare sector. But it's also attacking the critical infrastructure for this sector as well. Be it the power grids that enable surgeries or the devices that help to support and sustain life at hospitals or elsewhere. We also see state-sponsored criminal groups who are deploying persistent threats, advanced persistent threats to be exact. So these APTs, they're more often than not focused on the long game. And by that, I mean the long-term infiltrations that, in which cyber criminals are slowly and quietly crawling through networks so that they can access the sensitive data. And then once they get what they need and are undetected, then disrupt the operations. We're also seeing criminals are still finding it way too easy to exploit the behaviors of employees, just like this discussion that we had a moment ago, Kenan and I, and they're doing it through phishing, smishing, phishing attacks, which is just another way of saying through email, texts, and phone calls to literally trick individuals into revealing sensitive information or unknowingly enabling malicious activities. And we're also seeing the swift spread of interconnected devices, IoT, and this has augmented security risks to a whole new level. So, as these devices that have poor security come online, they become an instant target for cyber attacks. These are the so what factors about cybersecurity, which is why we're stepping through them, and the why you should care. So moving on to the next slide. So cloud security. Everybody that we know that have moved to this, not everybody, but many clients believe that when they move to the cloud, that somehow life becomes so much easier and the threats decrease and security problems and challenges just kind of by default dissipate, and that couldn't be farther from the truth. It introduces new risks at the same time that it introduces maybe a cost savings or conveniency, and maybe enables a lot of IT fundamental practices. It introduces new risks, including things like misconfigurations, sometimes data breaches, insider threats. And we'll talk a little bit more about insider threats going forward, and just insecure APIs, right? So we've also seen a huge increase in supply chain attacks, in which the software that's enabling a payer or a provider, large networks business model to flow in its processes with its business partners that may be disrupted. This in turn is actually compromising their, this trusted, agreement with vendors. And it's potentially injecting malicious code into legitimate software updates. And we saw that with SolarWinds. So, this is enabling criminals to purposely infect downstream systems. So where they start upstream, they've got a nice long opportunity ahead of them. And it's typically not caught until months and months later.
Hey, Lynn, can I ask a quick question on that supply chain attacks really
Sure.
quickly? So I'm thinking aloud on these medical devices, right? Because there's a lot more proliferation in patient, at home patient care, right? Where
Right.
you're having to use a lot more of that data enabled stuff at your home that gets transferred to the provider, right, through this cloud, right? Is that what you're talking about when you say supply chain attacks? That or is it the like uh McKesson who is providing bandages and blood and all that and
Yes, it's
that.
all of that. So, and McKesson was actually top of mind when you said it. So it can be everything from the value chain of how you get oxygen from a manufacturer to a distributor to a hospital, all the way to what you were suggesting, which is, and we'll get into this a little bit more, and we do around cloud security and connected devices, but the software that enables the sharing of information as well, not just the ability to, use products on patients. So it's all of it.
So that basically things don't get delivered. Is that what you're saying? How that those get tweaked and held for ransom in some way?
Yeah, exactly. And we saw that like with Colonial Pipeline, again, not a healthcare example, but that was a pretty popular supply chain disruption. So, and there's a couple of others, and we'll be able to get into them because I did pick out a few examples of where there's been disruptions. And I believe at least one, maybe two of them are supply chain related.
Thank you.
Sure, sure. Yeah, I'll just move through this really quickly, but we're also seeing zero-day exploits, which is just another way to say that starting from day one, there's already a vulnerability, and maybe a software developer or some other company isn't aware when they bring it online that there's already some risks for exploiting a vulnerability, and the criminals are very quick to identify it and to exploit it before patches or fixes are available. We have insider threats, I mentioned that earlier, and employee negligence. Insider threats, whether they're intentional or accidental, pose a significant risk. And as we mentioned before, employees are being targeted or, sadly, inadvertently enabling cyber attacks, through a phishing email, and then clicking when they shouldn't have, and enabling ransomware. We still have state-sponsored espionage that's going on. They're engaging in espionage to steal intellectual property, gain like a geopolitical advantage, or in this case, it's just simply to disrupt the critical infrastructure of other countries. And finally, we have increased sophistication of cyber tactics. I still think that the easiest ones and the most basic cyber attacks are on employees. But now when we talk about what the sophistication is, it's involving cyber criminals techniques on how to leverage artificial intelligence, how to use machine learning, and actually deploy automation tools to scale their attacks. So it's kind of scary in that sense. These really, though, are in my opinion, some of the biggest threats that make up the cybersecurity landscape that's affecting the healthcare industry. So we're going to go on to our first polling question, I think. Yep. So the option that best characterizes your organization's cybersecurity program maturity? Is it, well, it's kind of ad hoc. We have some stuff, but we don't have a lot of the basics either. It's developing, you're documenting policies and procedures and maybe business practices. Well-defined, there's roles, responsibilities, governance. It's managed. So now you're operationalizing everything and you're being able to track and monitor it. And optimized is really taking it to that next level where you're able to enhance it through all those things that I just mentioned before. Otherwise, you know, I don't know works too as an answer. So be curious to see. Good. All right. So we have about 75% that are in a that say that their organization is in a solid or optimized state. So that's really good. So now let's talk a little bit on the next slide, what the impact has been. I mentioned that I was going to go through some of the more recent breaches because it just wouldn't be a cybersecurity webinar without sharing some of the latest ones. And the healthcare sector, I should start with, suffered about 295 breaches just in the first half of 2023 alone. And this is according to HHS's Office for Civil Rights. And that meant that more than 39 million people were affected in these healthcare-related data breaches. Here are the top 5 that I'm aware of in recent months. Pharmacy Network, PharmAmerica disclosed a breach to OCR in May, and it impacted about 5.8 million individuals. And what they did is they discovered suspicious activity on its network in March. So again, happened in March, but they disclosed it in May. But they later determined that an unknown party had accessed its computer systems and potentially obtained personal information. So they had to report it. The Regal Medical Group, reported to OCR, I think it was in February of 2023, that in December of 2022, its employees that it had suffered a breach, and the employees were notified that IT department that they had difficulty accessing some of their servers, some of their applications and software that were on these servers. And because of that, they were able to determine that there was a breach. A threat actor had deployed some malware on its server and accessed and took sensitive information. So they had to notify the patients for which that data resided on the servers. I forget exactly how many, but Zoll in March, the medical corporation notified that about 1 million individuals were part of a data breach. Zoll develops the resuscitation and acute critical care technology, and it detected some suspicious network activity, I think in January, and immediately took steps to investigate. So by early February, it had determined that names, addresses, and things like social security numbers and birth dates were potentially compromised. You never really know if it was taken. I mean, there are some networks where you perform the forensics, or they're just not detailing to the public, all the details from the forensics of going back and looking at what happened, but they think that they were potentially compromised. So again, they have to let the patients know for that. For the systems and the software that was holding patient data on their networks. I'll go through just a couple more really quickly now. CHS was impacted by vulnerability and Fortra's Go Anywhere MFT solution. And MFT is just a fancy way of saying a managed file transfer technology platform. It allows organizations to exchange electronic data between systems and people. Anyway, it's a Tennessee-based health system, and it's one of the largest healthcare providers in the US. It has something like almost 80 hospitals across like a dozen and a half states. And then Cerebral, that's probably like the last one I'll mention. It's an online mental health platform. It had to notify over 3 million users of a data breach that stemmed from its use of tracking pixels. In January, it determined that it had disclosed protected health information to certain subcontractors without having really obtained the HIPAA consent requirements and assurances. So yeah, those are the top ones, including Central State Healthcare Systems, and that was an unauthorized party that gained access of an archive database, I think, that contained patient information. I think it's worth noting, though, that small businesses now account for 46% of all data breaches. So you don't have to be a major healthcare player in the market to be a target, and that's my point here. And it's worse that it's 60%. Of small businesses in general that are victims of cyber attacks go out of business within 6 months of an attack. So some additional details around the impact on payers and providers is, again, according to the OCR, healthcare firms reported about 145 data breaches in the first 3 months of 2023. And there were 707 publicly related incidences in 2022, in which 59 million records were stolen. When we look back in being here in 2023, some of the statistics I'm sharing, the new war surveys are actually being done as I'm giving this webinar. So some of the newer details don't come out until October, November, December. But we know that at least in the first 3 months, quite a few reports to the OCR. And when you think about 145 just in the first quarter of 2023, altogether, there were 707 publicly reported in 2022. So when you look at that tracking, it looks like it's on par from last year. 95% though of all identity theft incidences reported are coming from healthcare records. It's just, again, those statistics that I gave you, $1,000 for our healthcare protected information is what it's fetching, and compared to a credit card, it's like $5 on the dark web. So some of these reports suggest that the healthcare records are 50 times more valuable, obviously, and the most common forms of healthcare data breaches in 2022, again, because we don't have it, we're only halfway through right now of 2023. I don't see this changing. I think it's still applicable. The numbers may change, but the 4 types here aren't really going to change, I don't believe, for 2023 when they go through the next surveys. But hacking's at 555, unauthorized access is a big one. Physical theft and improper disposal of records is more minor, but still made the top 4. So yeah, Kenan, we can move right now to question number 2. Has your organization incurred a cyber attack in the last 12 months that was successful? Very curious to know. It's not uncommon for supporting our clients here that we've learned that they've had a successful attack in the last 12 months. All right. Wow. Nearly half said no. Very interesting. So 21% said yes, and a third are unsure. Okay, thanks for that. So what are some of the typical findings that we're seeing when we do perform assessments and audits? A big one is a lack of access controls and identity management practices. are most common. And of course, that increases the risk of unauthorized access to patient data. We saw multiple times where patch management processes tended to be lacking, and that was leaving the systems with known vulnerabilities. So there is a patch, they can patch, they know that they should, and yet we're still finding that patch management processes have, are still open tickets, if you will, in Archer, ServiceNow, or whatever system they're using to track their risks. Though it's not a major finding, we still see weak password policies, but mostly what we see is inadequate authentication mechanisms. So, and by that, it means that we're not seeing enough organizations that have either multi-factor or two-factor authentication. They have some measures in place, but largely some of the organizations that we've seen are open to unauthorized access to critical systems. We see incomplete or outdated incident response plans. If they are complete and if they are, relatively new, like within the last year or two, or maybe three, they hadn't been tested. But that again, whether they're outdated or not tested, it could lead to potentially delaying a timely detection and response to security incidences. We also see a lack of regular security awareness training for employees. And, look, the stakes are really too high these days not to have some robust training program in place, because employees default to what they know. So if an organization isn't really providing monthly or at least quarterly knowledge training, and I would submit knowledge training that is tested, it's at greater risk, right? Again, for the reasons that we mentioned earlier, the phishing, the smishing, the phishing, social engineering. It just makes the employees more susceptible to those types of attacks and, worse, ransomware. So we know this because we perform a lot of audits around social engineering and pen testing. And so we see that as a common gap. Some additional findings on the next slide is we also see inadequate logging and monitoring mechanisms. It really limits the ability to detect and respond to security instances either swiftly or most effectively. We also see vendor management processes that are insufficient. This, I think, is a big one. We see a lot of this. It's pervasive across all industry sectors, which is there's little to no cyber assessment prior to onboarding a vendor. And if they did onboard, then they go years without being reassessed. And that can be part of the contractual language when there's a partnership between the healthcare entity and their vendors or contractors. Because without this third-party risk management program that includes the monitoring and really kind of looking under the hood and kicking the tires, they're potentially being exposed to their third-party risks. Remember, supply chain downstream. So we also see.
Hey, Lynn,
Yeah.
just had a quick question here. Is how common is unsupported software?
More than you think. There are some organizations that sunset and those software applications when they know that it's not going to be supported. But gosh, if I had to throw a dart on the wall, I'd say probably a third of clients still have legacy systems that are not supported. So insufficient disaster recovery and BCPs, business continuity plans. It's common. And you know why it's common? It's because there's this major digital transformation, right, that we talked about at the very beginning that's occurring. I know it's occurring through most organizations that are trying to keep pace with technology and trying to keep pace with having a competitive edge in the marketplace. And so when you do that, you've got 100 things on your list that you're trying to get done. And one of them might be the business continuity plans or disaster recovery plans need to be updated, but it's an afterthought. And unfortunately, it can be an afterthought once, some type of vulnerability has already been exposed. And finally, we see insufficient employee termination procedures. I would say, gosh, probably every time we've sampled and tested the operational effectiveness of controls for employee termination, it is rare that we don't find that somebody was terminated 2 months prior, 9 months earlier, and they still had credentials where they could, technically gain unauthorized access to systems or data from the outside. So I think this leads us into polling question number 3. And what cybersecurity controls have you observed, either assessed or audited, or maybe tried to implement that's most problematic for your organization? These are ones that we see. It'll be interesting to see what yours is. And while you all are responding to this poll question, I'm going to ask for a time check. For my
Yeah, we're 32 minutes in.
Okay, thank you.
Need a couple more people to respond, and we'll be there.
Great. Okay, all of the above seems to favor. So asset management, access controls, data security, and all of the above. And we have a third that aren't quite sure, which is fair if this is not your area of expertise, not something that you monitor, you might not be aware. We too find asset management out of all of these to be the usual suspect that tops the list. That's problematic for organizations, just understanding what data you have, where it's located, who has access to it, and for what purposes, and do they still need it, and what are the controls to allow for least privilege. So thank you, Kenan. So how do we help remediate some of these gaps or mitigate the risks that we've just started to go through over the last half hour? I have some high-level activities. They're high level, but nonetheless, they're helpful towards maturing a program to operationalize some of these efficiencies and effectiveness, and just adequately engaging in proper risk management. I mean, just the bare minimum. These are some of the basic blocking and tackling calls to action. For data breaches, it's identifying and implementing some robust encryption solutions for data at rest, data in transit, and helping to implement some access controls. As I mentioned earlier, 2-factor or multi-factor authentication like Okta is very helpful as well, and just performing basic routine security audits. Whether it's an enterprise one, an enterprise-wide, which might be something like the NIST cybersecurity framework audit, if it's picking out certain sections of high trust and making sure that nothing has changed based upon digital transformation initiatives that you've implemented, those are helpful. For ransom attacks, of course, the risk is, the encryption of critical health data that's going to disrupt your operations, and worst case is extortion for financial gain, which is usually why ransomware attacks occur. But deploying some of the leading practices for backing up data offline and implementing the network security controls that, making sure that your firewalls are configured properly, as well as some of your software applications, and conducting these patch management audits to make sure that they're happening in a timely manner is crucial. But I also think, external hard drives are a popular choice for offline backup solutions. They offer portability, they can store large amounts of data. They also provide, I think, a much simpler way to transfer files in between computers or vendors if needed, and can be easily stored in a safe location. The third one, insider data theft. There are employees with access to PHI that will intentionally steal or misuse the information. And of course, that can lead to financial loss and brand reputational issues. So implementing least privilege access controls, developing an action plan for monitoring data access, and establishing and implementing policies is crucial, but probably having some type of tool or technology that can spot or detect when there's a threat, like Arctic Wolf, or something like maybe CrowdStrike or CyberRock. Those are some of the tools that can help with this. But I think establishing, communicating, and actually implementing consequences for strict data handling is going to be one of the biggest, one of your better successes up front and early on. But yeah, it does prove valuable to invest in some of those tools and technologies as well. On the next slide, phishing attacks. I can't underscore enough, the periodic training is essential for phishing attacks. Again, most often the cause of ransomware, and organizations really need to help their employees understand the techniques that are being used against them, and practice with them by providing monthly mock phishing emails. It gets them used to it. It gets them understanding the types of techniques that are being used. But also, consider the tools and technology to deploy email filters, because those email filters are going to detect and block attempts for stealing or accessing data as well. Medical device vulnerabilities, really implementing robust network segmentation. Again, here we go, regular patch updates, updating medical devices, right? So you have devices that might have the proper controls that are built into them, especially as they talk to the cloud and software and applications. But if those devices become outdated and aren't replaced, then it doesn't matter what you're doing with cloud security and patch management if the medical devices themselves present a risk. So, conducting a thorough vulnerability assessment through pen testing is really key. Pen testing for your internal network, external pen testing, wireless pen testing, and the like is really big. And finally, third-party vendor risk management. A critical piece for the reasons that we mentioned earlier around supply chain, especially due to all those attacks. But one of the ways that you can do that is, and we mentioned it earlier, was conducting due diligence when selecting vendors, making sure that you're putting them through their paces in terms of what is minimally acceptable from a cybersecurity perspective, and communicating what your expectations are for them to maintain those controls, and establishing really strong airtight contractual verbiage for data security, and then being able to audit your vendor and their security controls, right? I mean, federal government does it for all of their vendors, so, or at least has the ability to do that. So I think integrating that as part of the contractual piece of this and the cybersecurity program will go a long way. So I wanted to shift now to IT spending, and for 2023 and beyond. It's a good segue looking at IT spending to get to what we want to really know about, which is what's everybody spending on cybersecurity budgets. So while we don't have specific dollar amounts of cybersecurity budgets, we do have the data points we need to solve for X. And that's through understanding how cybersecurity budgets are a percent of an organization's overall IT spending habits. So I'm going to walk you through that. I've got a couple of slides. I'm not going to spend very much time in each one. So I'm just going to give you the clip notes. We know that payers, and if you can hit it one more time for me, there you go. We know that payers and providers spent globally like $53 billion and $120 billion respectively worldwide on healthcare IT spending, right? And the compounded average growth rate, the CAGR, for IT spending by health insurers or payers is about 9.7%. And for hospitals, it was 10.7%. That's a good number. And I'll give you, I'll explain that more on the next slide or the slide after. But if we move to the next slide, 40% of US healthcare providers have an overall IT spend average of approximately $40 million a year. And this is according to Flexera's most recent study that I have access to, which is 2022. Again, they're going to have one coming out here in the next couple of months. But, you know, that's across 8 different industry sectors that they have 40 million. And what we found is 40 million is their overall IT spend. And what we found is that for the US healthcare sector in particular, the range of IT spend is typically based on gross revenue that allocates somewhere between, I think, 6 and 10% for IT spending. So what's the average of that? 8%. So remember that. On the next slide, though, the research that I performed in the surveys that I reviewed, and there were plenty, and they're like 70 to 100, 120 pages long. But out of 40 industry subsectors, 40, hospital IT spend is the second largest on the list behind entertainment online. Think about that. It's the second highest behind like your Netflix, your Hulu's, your Amazon Prime. I mean, gaming's a huge industry. So it's coming in at 11.6% for IT spend. That's big. And hospitals are the third highest sector out of 11 for IT spend. So if we move to the next slide, and this is where I wanted to spend just a little bit more time, is this. So we understand what the IT spending looks like for US healthcare sector as a percent of their gross annual revenue, right? I think we were talking about an average is 8% IT spend on the total annual revenue. So let's talk about cybersecurity budgets as a percent of IT spending, because nobody's giving away the secret information of exactly how much they're spending. And I'm not sure why. I think they've tried surveys in the past to get actual numbers. I don't know if it's because people don't know the actual numbers in the cybersecurity program, or they're not talking to the right people, or they just don't want to give out that information. But 15% of the healthcare organizations invest at least 7 to 10% of their total IT spend on cyber budgets, and another 6% allocate over 10%. And so 23% have no specific caveat at all. But I want to be clear about this last part. 15% spend 7 to 10. Another 6% spend over 10% of their IT spend on cyber, and 23% have no specific caveat at all. So to be clear, this last group of 23% has communicated that they do not fall in the categories of no money is spent, or I don't know how much is spent on cyber. They also bypass the first 3 options as not being applicable to them. They don't spend anywhere between 1 to 10%, and they bypass, we spend over 10%. So maybe it's too much of a leap or too much of an assumption, but for this next bar, I applied a cadence of like maybe that 3% range, right? From 3 to 6, and then from 7 to 10. So somewhere it would seem it starts at 11% that their cybersecurity budget makes up of their IT spend, and maybe conservatively up to as much as 14%. This bar then suggests that 23% of the respondents are allocating, over 15% or more of their IT spend. So why does that matter? So if we look at the total of that, the 15%, the 6%, and the 23%, what we have is 45% of respondents have cybersecurity budgets that range between 7% and at least 15% conservatively as a percent of IT spending. So, and I'm wrapping up this slide. If you're a healthcare entity with, say, 500 million in annual revenue, and then, which case you might likely spend 8%, if you remember that number, on IT, that equates to $40 million on IT. And on average, perhaps 11% of that is spent on cybersecurity, right? Because if you take the average, it comes out to be about 11%. That means about 4.4 million. And this one example would be spent on cybersecurity. So do you know what the dollar value is of your organization's total IT spend, right? It's typically a percentage of your gross annual revenue. And if you do know it, then you can multiply it by the average of the cybersecurity spend range of 7 to 15%, which is 11%, to see if your organization is actually budgeting for that amount for your cybersecurity program. We're going to go on to the next one, which is a polling question. What percent of your organization's overall IT spend is budgeted for cybersecurity? Do you know? It would appear, again, as it's typically 11% is the average.
We're not getting it's pretty decent respondents, but I'm noticing the hesitation. So we look at this, a lot of unsure. Right?
Yeah. 7 to 10%. Okay. So, but at least a third had some idea, or close to a third had some idea. A and B, I think if you're not somewhere between 7 and 11%, based on what we know that's happening in the cybersecurity landscape and its impact on payers, providers, and third-party administrators, that might be an area to take a look at and understand. Not an issue if you haven't had any cyber attacks, if you haven't had any data leakages, if you haven't had any data breaches or compromises to your network system. So, but typically, most of our clients do. Just depends on to what degree. Next slide. So our wrap up. When I read all of the surveys and studies, and in speaking and supporting dozens and dozens of clients in this space, what we have learned and what we are being told is that small businesses now account for 43% of cyber attacks annually. And criminals are attempting network attacks every 39 seconds. And on top of that, they can penetrate 93% of all networks, which is kind of a scary statistic. Ransomware attacks are occurring every 11 seconds. Now, they might not be successful, but at that rate, they're probably having a lot more successes than we would like to see them have. 82% of the CIOs believe their software supply chains are vulnerable. And in 2022, 3 out of 5 companies were hit with supply chain attacks. We've got an increase in social engineering attacks, and security executives are telling us in these surveys that, and in real time as clients, that they're not prepared for these types of threats, but they are actively evaluating how they can enhance their program and the types of strategies and tools and technologies and expertise of people and talent to adopt and bring in and integrate into their cybersecurity program so that they can be more prepared. Some of the leading practices, of course, is just continuously identifying risks, having a program to monitor risk and to mitigate it, and to frequently test it, perform annual program reviews, whether that's through HITRUST or, as I mentioned earlier, then a cybersecurity framework or something through ISO, whichever one is using. But most of the organizations I've worked with in this space are using HITRUST. If they're not HITRUST certified, they are definitely more often than not using NEST, although ISO and CSC are also good frameworks. Got to regularly perform the patch management and educate and train employees continuously. Frequently pen test web applications, IT systems, networks, and devices, and do what we do for a number of our clients, which is routinely conduct the audits at the system, the program, and enterprise levels. And that concludes our webinar today. So I don't know if we have any questions, Kenan.
Right, so I've been asking them along the way. So you guys, this is the opportunity. It's about 8 minutes till the top of the hour. If you have any specific questions, you can, if you want specific questions, you can reach out to Lynn or myself, and I can get them to Lynn. Or you can ask them now, and I can unmute your phone if you want to raise your hand or ask a question. So I'm going to give you like 15 seconds here. If not, we're going to excuse you all and give you the gift of time back. Okay, great.
Thank you all.
Yeah, thank you all very much for your time today. Thank you, Lynn. This is very thorough and comprehensive. Everybody, again, you will be getting a questionnaire, a survey, as well as if you have the CPE information. Have a great day, and thank you for attending today.
Thank you, everybody. Thank you, Kenan.